Hi, it's me, Latanja, coming back again with some more FMLA information for you. So you want to know, can you take a leave for stress? Yes, you absolutely can take a leave for stress. Let's just say, example, you're at the job. Your boss is stressing you out. You are feeling sad. They are constantly on your back. It's causing you to have mental health concerns. Of course, you need to do something. You cannot continually go to work feeling this way. You are feeling down in the dumps. You can't even do your job. Your boss might be micromanaging you. Like every single little moment, it's like they're trying to find something to nitpick on you about. I understand that. I've been through that. You have a boss that's just sitting there wanting to find something to get you riled up about, and it feels like every day, all the time, there's something going on that they're trying to get on you, and it just feels like you're being picked on. That can cause you to have like anxiety and depression in itself. So you go to your doctor and you let your doctor know, hey, this is going on with me. And so when it's time to get your paperwork filled out, they can't just put that you've been stressed on there. No. There has to be an associated mental health condition. So anxiety, depression, even it causes migraines. That can be a symptom of some of these mental health conditions. So when your doctor puts that on your paperwork, then we look at it, and then it's like we look also to see what type of treatment does this person have for these conditions that they're saying that that the doctor's saying they have. So does this person have to have visits more than twice a year? Is this something so serious that this person is having to have visits twice a year? So they might say, yeah, you're going to be going to a therapist. Your doctor might say, I'm going to refer you to a therapist because not only are you going through this issue, and I'm going to do what I can. For example, they may prescribe medication to you. So not only I'm going to prescribe this medication, I'm also going to refer you over to a specialist, which may be a therapist or a psychologist, so that you can talk to them every week. And you can kind of get better because it shows us that this is this is treatment. Like this person is really going through it, and they're also making the steps what they need to do to get better. Because you're going to need to take it for the days that you're needing to be off. If you want to do an intermittent leave, like if you want to do days here and there, and you might have a day here and there. But sometimes it can be so overwhelming that you are crying, you're shaking, you're having panic attacks, and you can't even stand to go to work. And when that happens, your doctor would have to take you out for, you can go out up to 3 months 12 weeks on an FMLA leave. So you would have to go through that process, and they would have to recommend however long, because you don't want to be up in work sad, shaking, crying just because you're being harassed by someone. That's not fair. It's not fair to you, and it's not fair to any children that you may have, especially for us moms and us. It's like we need to make sure that our mental is together, because if our mental is not together, then nothing's together. We have to keep everything together for our children. So sometimes you might need that break. You might not want to take out time at work, and I understand. You might want to be at work doing your job, but sometimes you just can't do anymore. And that's me coming to tell you that you have benefits in case this happens to you. Your job, sometimes, even though the benefit may be available to you, they're not going to tell you that you can take out up to 3 months of work, because they can't replace your job. So if you're gone, then they have one less person doing the job. So they're not really concerned about your well-being. Sometimes some managers and everything, especially in the situations where the manager is the person who's actually causing your stress, or not helping it, or just adding to anything that you might be going on in your personal life. And then you come to work and you have someone just for some reason taking things out on you, trying to make your life so much difficult. So this is what I'm here to let you know. You have benefits. If you are stressed out and that has caused a mental condition, or it has caused a physical condition, because sometimes stress, the way it comes through us, like it can be physical. Like physical things can literally start happening to you from stress. So make sure that you are getting the treatment that you need, and make sure that if you need a leave to go to even doctor's appointment, even if you don't need a leave for 3 months or, a month or however long. If you just need, hey, some days I wake up, I'm not doing very good. I'm stressed out. I can barely breathe. I can barely catch my breath. Some days that can happen and you might just need to call out. So that's when you would need to utilize an intermittent leave. So as long as if you're having these mental conditions and you have all this treatment, you're getting your medicine, you're having your treatment visits a couple times a year, you're referred to a specialist, like these things show us that this person needs this leave. So you can take your intermittent leave, you can go to doctor's appointments, you can stay out of work some days when you're just not feeling up to it. So just make sure that you use your benefits, because like I said, they might not tell you. And I'm here to tell you, you have these benefits and you have to use them, because you have to make sure that you are good. Self-care, because you're the only one taking care of self. No one else is going to take care of you the way you take care of you. And if you don't take care of you, then the whole ship could be down. So make sure that you are taking care of you. If you need to file an FMLA leave, you make sure you do that. And if you have any questions whatsoever, I am here. Because I've been through it. I've lived through it. I work through it every day. And I'm very experienced in FMLA leaves. Just leave a comment if you have any questions. If there's any other things I can answer for you, I would love to do that.